Assalamu alaikum, hello and welcome to the Health Show, here only on the Islam channel with me, Alistair Greener. Tackling health problems every week, we're joined by a health expert within their specialised field who discusses the prevention of health issues or concerns that we or our loved ones may face. Looking at how you can change your health and lifestyle for the better, the Health Show offers an alternative viewpoint from our health experts who attend the show. And we hope that this will help guide you in the right direction. So if you suffer from any medical issues or have any health concerns, or for that matter, if you know anybody who does, then tune in each week as we'll be covering a wide range of topics and offering alternative viewpoints from our health experts. If you'd like any further information on our programme or any of the topics that we discuss, then please do get in touch at healthshow@islamchannel.tv. Now, on today's show, we're looking at dental care. And dental care, of course, is the maintenance of healthy teeth and is sometimes referred to as oral hygiene, dentistry and also oral surgery. To discuss the issues in depth, it's a great pleasure to welcome Dr. Khalid Master, a dentist from the Bankview Smile Studios in Blackburn. The dental practice has won the national title UK's Best Dental Clinic 2 years in a row and has won more than 28 other regional, national, dental, business and community awards. Great to have you on the show. Thank you for being here.
Thanks, Alistair. Thanks for the invitation.
Lots to talk about, an incredibly important topic as well. But before I talk more with Dr. Master, we'd like to show you a very interesting short video clip that looks at the work undertaken by the Bankview Smile Studios. Due to their growing reputation, they have more patients who have highly successful professionals in their own field. Many are healthcare professionals such as hospital consultants, GPs, nurses, midwives and even dental nurses and dentists from other practices. Patients also come from far and wide, regionally, nationally and even internationally to seek treatment. Let's take a look.
At Bankview Smile Studios, we all believe that we are in the happiness business, whether that's to do with how we make you feel with the treatment that we provide or how you feel just in our company.
Staff to be very good and very helpful, and over the past few years I've had treatment from both the dentists here, and I must say that I do find them to be very, very professional, and I feel very comfortable coming here for my dental treatment. I find it all to be absolutely first class.
One of our philosophies at Bankview Smile Studios is that all our care is patient-centred. Everything that we do, from your convenience or your comfort, is all revolved around what is best for you, and we will do our level best in order to accommodate your wishes.
Actually, watching the video there, it makes us realise how much dentistry has changed, seeing all that high-tech equipment and so on. It's a big change over the last 10, 20, 30 years.
Anything and everything that we can do, especially a lot of the technology you saw on VT there, was to do with making things painless and making things more patient-centred. So yeah, absolutely. We don't shy away from investing.
It's interesting you saying about high fear. Yeah. That is still one of the big things, isn't it? I mean, nobody says, I can't wait to go to the dentist.
Yeah.
You know, it is that fear thing, which hopefully people are thinking of their health and actually putting that behind. But there must be still some people who are almost sort of paralysed by the fear that they have of going to the dentist.
Absolutely. It's the number one obstacle. I know that there will be mainly adults out there who might think to themselves, cost is the number one prohibitor, but it isn't. It's fear. Fear is the number one, and I think the dentists that can help overcome that or build rapport quickly, put patients at ease, they're the ones that are most successful.
And it's interesting you talk about rapport there, because that's incredibly important, isn't it? The trust that's built between patient and dentist.
Absolutely. I mean, we're talking invasive, irreversible surgery. So you'll know the importance that, say, for instance, ladies in particular will put to their hairdresser. And even if that person moves, they'll go to the ends of the earth. This is very much like that, in that once you've built that trust and rapport, even if that person moves on, usually you'll follow. And it's because it's even more important, you know, because there is some elements of the things that we do are unpleasant, and we have to stand by that. But as we'll probably talk about in the show, with every single procedure, you can break it down, deconstruct it, and see at each step how you can make it easy when you see it from the patient's perspective.
Well, we're certainly going to talk a lot about different areas of oral health, and especially in the second half of the programme, we're going to talk a lot about children's oral health, which I know is incredibly important to you to get people started in the right direction early on. Let's begin with the real basics about looking after our teeth. Why is it so important that we don't neglect them?
It's very important. I think that the key issue in all of healthcare, every single health professional that came into the profession, whether it be dentistry or anything allied to medicine, we will all say that the prevention is better than the cure. All of us firmly believe that if you can nip something in the bud, prevent it from happening, it's far better than trying to fix it later. And dentistry is no different. I think that patients, when they appreciate that teeth tend to take the starring role, but the truth is that there's gums and there's bone. So when you think about the three main tissues of the body that you need to preserve and you need to protect, it's the enamel of the teeth, which is predominantly under attack in tooth decay. Then there's gum disease, gingivitis, and then the more serious one, which is bone loss, the support around the roots of the teeth, which is largely periodontitis. And if we can catch those early, educate patients, get them to form good habits. As we know, habits stay with you. So if we start from the younger years, from children upwards, and we can get them into good habits, hopefully that will then put them in good stead for the rest of their lives.
And that's a real key, isn't it? You're talking about being preventative, and one of the things that people often might say is, you know what, there's nothing wrong, I haven't got any pain, I'm not noticing anything wrong, I won't sort of let, you know, I want to let sleeping dogs lie a little bit. I don't want to disturb anything that might be there. What do you say to those people who you know, almost burying their heads in the sand?
What I tend to say is that first of all, I understand that viewpoint, and I know that there's many people within certain cultures and backgrounds who have that belief. There's kind of old wives' tales where, you know, if you're feeling okay and you're symptom-free, don't engage with them. They'll poke around and make matters worse, and you'll be worse off for it. And I have to say that the main message is, it's like a volcano waiting to erupt. So although you're okay at the moment, like with anything with regards to the seesaw analogy, the closer and closer you get to the fulcrum, once you tip over the other side, it's a slippery slope. And I think that all good healthcare professionals, they will be honest with you if you present to them and there's very little that they need to do, and maybe just give you a few bits of advice in order to maintain your good health, then they'll do that. I think that intervention will only be prescribed and intervened once the correct diagnosis has been reached. So don't be fearful, engage with them, and even if you're doing well, we can, all of us with bespoke advice, you can do even better.
And the real key is going to your dentist regularly for checkups to do what I call head them off at the pass kind of thing.
Yeah,
so
absolutely.
to spot any early signs that may be going wrong. How often should we be going to the dentist if we're, you know, a regular adult with no particular issues?
Okay.
How often should we be going?
Yeah, very good question. On average in the UK, most the dental associations as well as the health service will tell you, go once a year. Now, depending on your level of need, so we've talked about that, so for the low maintenance type of people who have got very minimal gum disease or gum inflammation, don't really have a history of tooth decay and have a good family history, because we know that genetics plays a big part, then maybe even once every 2 years is okay, or 18 months. But then there'll be people with higher needs who either have a tooth decay issue or a gum disease issue. They should go every 6 months. And then if you have even higher need where there is maybe tooth and gum problems, maybe even every 3 months. So most of the literature, or the National Institute of Clinical Health Excellence, NICE, have ruled that recall intervals for dentists is between 3 months and 24 months.
Now, we're going to talk about children in the second half of the show, but does that period of inspection change according to your age? So, you know, if you're younger, do you need more or less periodic checkups than when maybe you're in your 60s and 70s?
On the whole, no. It's all based on need. So if you're a child who has maybe a predisposing condition, and maybe you've heard of enamel hypomineralization. So this is quite common, where the outer layer is weaker and it's developed that way. It's no one's fault. We have some theories as to why that happens, but it can happen in utero. This is before you're even born, because teeth, most people are surprised to find that actually teeth are mineralizing in the womb, and the adult teeth are mineralizing in the first year of birth. And again, way before they actually erupt into the mouth. So if, for instance, you have a systemic illness or you've had a difficult pregnancy, the development of that enamel is compromised. So the moment they come and erupt into the mouth, they're diagnosed. And if those people start to find that it's more chalky in consistency rather than marble, so these people need to come more often. If, on the other hand, they're doing well at home, they like brushing, they've got a good diet, which is low in sugar, low in acid, again, we'll talk more about that later, then those people can come every 6 months to a year.
Well, let's talk about sort of, you know, what we should be doing in between times. Yeah. So first of all, brushing. How often should we brush? And also what time of day? Because there's a bit of a discussion, isn't there, before or after meals? What's your take on all of that? Absolutely.
So you've hit upon some very new research that's come out. And up until now, the debate was out. There was two schools of thought, the pre-meal brushing, especially pre-breakfast, and those that are after. It's now the research is showing that the pre is better than the post. And I know that the two schools of thought were to do with eliminating the bacteria in the first place, so that whatever dietary intake you have, there's nothing to feast on that. And then there's the post-meal brushes that would say, well, I'm dealing with the bacteria and the food debris, so surely it's better after. The issue and what the research leaned towards the pre-meal was the acid content. And this is a very important point, that in nearly all food and drink there is some element of natural sugar, and there's certainly some element of acidity. So if you've had something that's low pH, what will happen is that the outer enamel is softened. Now, if you then brush, because the bristles of the brush are abrasive and toothpaste is abrasive, actually that's a big no. So it takes about 45 minutes to an hour to remineralize softened enamel. If you're going to use an abrasive at that stage, you're actually wearing your tooth protection away.
Because you've got that extra surface.
That's right, and it's soft.
And what about the next thing? So we brush before our meals.
Yes, that's true.
And
frequency, we're talking usually 2 times a day.
Okay.
So we will say morning and night, but if you're really good and the opportunity permits, with every meal.
And then for how long?
Okay, good question. We say on average it's 2 minutes, because what we're talking about, and again patients have to understand, is that every single tooth has 5 surfaces. So there's an outer surface, an inner, a top, and then if you pull the teeth apart, there's the interproximal surfaces. Now, if by the time you've done all the outside, the inside, the top, upper jaw, lower jaw, and then you're doing your interproximal, it usually takes between 2 and 3 minutes anyway. So I think this is where the 2 minutes has come in. Most electronic brushes, as you know, have automated timers, they're integrated, and excuse me, and they're set to 2 minutes, and they even have pacers which every 30 seconds give you an idea of where you should be in the mouth.
Wow, so there's a lot of help. And actually, you talk about electric toothbrushes. Again, my understanding is that there's a common consensus now that electric is better than manual.
Yeah, when they first came out, I fully understand that, and there was a lot of scepticism. They were seen as gimmicky, and they were also quite expensive. But now, absolutely, without doubt, all the research dictates and directs towards the fact that it's not even slightly, it's much more significant. So electric or motorized brushes are significantly better than manual. And just be wary, the battery operated ones are meant for children and adolescents. The mains rechargeable ones are the better ones. So if you are going to purchase, my advice would always, certainly as an adult, steer you towards the mains rechargeable. They can be a little bit more expensive, but there's always offers. So look out for the offers and go with that, because your cost of ownership will be better, and the outcome, the power within which the motion happens, is better with the mains rechargeable.
Now, there's the two sorts as well, aren't there? There's the sonic ones and the regular ones, and then you've got the different types of heads, and then how long do you keep the heads for? So give us a bit of guidance on that.
Absolutely. So two main types. So there's the ones that are the small round head that we call the mechanical counter rotation. So the mode of action is oscillating. The newer ones also pulse in and out. So there's a 3D motion, and then there's the sonic ones. So the big difference here is that the mechanical counter rotation, the bristles need to be locked onto the tooth surface with pressure, and that the bristles do the work. The sonic ones are so clever, they are even next level in my opinion, where you don't even need to touch, because each and every bristle is doing a figure of 8 extremely at an extremely high frequency. So for instance, the RPM of a mechanical counter rotation is about 4,000 RPM. The ones, the sonic, are 40,000 RPM. And so what's happening is the bristle is creating a fluid motion, and it's the fluid dynamic that is actually doing the cleaning. So it's very much more, I know it seems counterintuitive, but it's gentler but more powerful.
But more intense. Yeah. And how often should we be changing those little heads?
Good question. Most of them, the manufacturers are quite clever. They've got an indicator bristle, so they've got a dyed one, usually a blue colour, and as the dye reaches halfway, that's when they would like you to swap. There's a much simpler method, even if you have the indicator bristles or not. For me, the simplest one is the visual. If the bristles are upright, they're fine. If they start to become splayed, then they need to be replaced, because once the bristle is splayed, the side of the bristle cannot clean, only the tip.
Next, I mean, we're covering a lot of ground here, so this is fantastic. The next big one is the mouthwashes.
Yeah.
Are they any good? Should we be using them?
Good question. In my opinion, they have less than 5% impact. So even though there's a bigger array, so going back to the tooth surface analogy, if you've got 5 surfaces of cleaning, your toothbrush can reach 3 out of 5. So a toothbrush does 60% potentially of the work. The interproximal areas is 40%. The interdental devices, which I know we'll talk about later, the floss with the handle, and the TP brush, the spiral brushes, they do about 40%. Now, because we'll never get 100% of the available space with either of those, then the mouthwash, which is a liquid medicament, will try and get that, mop up the areas. But the main issue I have with patients is that too often they are substituting mouthwash for interproximal cleaning. It is a third line of attack. The toothbrush is number 1, the interdental device is number 2, and only then we will consider mouthwash. And I know we haven't even talked about toothpaste, because that's even smaller as an impact. As a dentist,
it's more the action.
It's the more the mechanical, physical action. It's going back to physics, the solids, liquids, and gases. The solids will have the biggest impact, liquids will have the next, and gas has the minimal. And I know that as a dentist, the number 1 question, the moment someone finds out that I am a dentist, the first question is, which toothpaste should I be using? And the honest truth is, it really doesn't matter. They've all become more and more confined towards one particular formula. They're all high in fluoride, and other than the flavours, there's not much difference.
Okay, that's a good method. So actually, maybe buy the supermarket's own brand sometimes.
That's right, yeah, no problem.
Now, the other thing we see in the dentist aisle of the supermarket are, as you said, these interdontal devices. Yeah. Tell us a little bit more about them and why they're so important, because actually we've probably only really seen these. We've seen floss maybe for quite some time, but these little TP brushes that you talk about, they're a lot more recent. How important are they?
Absolutely critical. It's the one thing since I graduated, and I think with my patient base and a lot of my colleagues, they will say that that's the game changer. Because as you've said, floss has been around for decades. I have to say, unfortunately, as Brits, we have been behind the curve when it came to taking it on a regular basis, and I still find, even to this day, some new patients will honestly admit that they hardly ever do it, or they use it mainly to remove food, but not to disturb plaque, which is what their primary aim is. But if we think about the main difference, and this is how I put it to my patients, is that your floss is a single filament device. It's quite fiddly. If you're using the traditional tear-off, to wrap it around your fingers, you're using a fist grip. If you use the floss with the handle, then at least it becomes a finger grip. So access and visibility is better, but ultimately it's still a single filament device. If you compare that to the spiral brush, which is what you referred to, you've got single filament versus multi-filament. With floss, you've got to go down each side of the tooth independently, so you're only doing one side at once. The 360-degree spiral is doing both sides as well as top and bottom. And also, if you've ever got anything spherical stuck between your teeth and you've tried to floss it out, it's extremely frustrating, because no sooner do you think you've got it and you try and flick it out, it spins round again. But the one thing that the spiral brush does is, once you've got the right diameter and it fits between the teeth, it completely eliminates food particles. So I think they're so much better.
So at the end of the day, we should be brushing, flossing, using the little brushes as well, and that should only really take 3 to 5 minutes.
Absolutely.
Perfect. We have so much more to talk about in the second half. We're going to be talking about maybe the more cosmetic side of dentistry and also children as well. But for the moment, thank you very much indeed. Now, we must stress that should you suffer from any medical problems or health concerns whatsoever, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. Lots more to talk about. See you after the break. Welcome back to the Health Show, where our topic today is dental care. And we've been joined by Dr. Khalid Master, our expert on today's topic. Now, food and drink that was enjoyed by guests at the 90th Academy Awards included custom cocktails, black truffle and ruby chocolate, strawberry and cream. Oh my goodness me. Having great celebrations can always come at a price, but how much is too much indulgence when it comes to having a sweet tooth? Let's take a look.
This is actually a raspberry mousse in a sugar globe here. So the people are gonna say, what is that? All we have to do is take a spoon, crack it open, you can see it's like glass, and we have a delicious raspberry mousse with fresh raspberry and raspberry coulis in here.
We have to serve individual plates of food like this, 17,000 portions in 2.5 hours. Individual tray passed hors d'oeuvres, 20,000, 2.5 hours. So it's a very organized chaos, but very fun. Everyone goes through 3 weeks, 2 months of dieting and, losing all this weight for the Oscars. At the end of it, you want to eat a little bit. You want a little comfort food. You're hungry. So having a pot pie, having a mac and cheese, having something that's comforting and fun, a little chocolate, a little Piper Heidsieck champagne, a caviar, with baked potato. These are the things people want.
Win or lose, they'll come by and see us at the official party. They walk right out of the ceremony. Everyone comes through to get their Oscars engraved. And so it's, regardless, after a big event like that, everyone's ready for a cocktail. Pour something on top of it.
Well, not all of us, unfortunately, get the opportunity to have such fantastic food and cocktails. But on a serious note, what we eat and drink does make a big difference, doesn't it, to the way our teeth, are looked after?
Absolutely. As I said, plaque control and control of bacterial buildup is number one. Diet and food is number two. So the two main things that we need to be wary of is sugar in the diet and acids, because both have an impact. So the sugar is the main food source for bacteria. They love it. Fermentable carbohydrates is their number one choice. The more of that there is, then the bacteria will proliferate, and their metabolic byproduct is acid, which then dissolves the tooth enamel. And the principle is the same for the acids within food and drink. So within foods, it's mainly the citric acids within the sour fruits and foods, and of course fizzy drink, which is a big issue. So as we know, when carbon dioxide is bubbled through water, we get the fizz, and that leads to the production of carbonic acid. And with regards to certain drinks which are also citrus flavoured, then you'll have citric acid, malic acid. There's also other acids that are used as preservatives. So as we know, I'm sure most scouts and school children have done the experiment of putting an old copper coin in some fizzy drink, and you only need to see what happens, and that's solid metal. So of course, enamel, even though it's the hardest substance known to man when in a biological sense, over many, many years of repeated attack and trauma, of course, it will yield at some point.
And that brings us very neatly on to the whole subject of child dental health, because as we know, children are quite susceptible to something sweet,
Yes.
The fizzy drinks that you were talking about and so on. Now, I know you have a very strong passion for getting children into the dentist as soon as possible. Give us an idea, at what age should really a parent present a child to the dentist for the first time?
Excellent question. It's either when the first tooth erupts or at 6 months post-birth, which is, again, I still find many mums, especially first-time mums, they're shocked. They still, I don't know quite why, but there is still this notion that when they start reception is when they should be attending. They're 4 years old, they've had all of their 20 teeth. Teeth will erupt from around 6 months to 2.5 years. So you'll get your full complement of 20 teeth within that 2-year period. So even though the tooth may have only just come through, and you may think, well, what's there to check? But there's so many other things. There's speech things, there's dietary information, there's the enamel hypomineralization, especially if it's coming through with the first few teeth, you can nip things in the bud. So there's development issues, speech issues, because of course the other thing is dummies. This is another big thing with children. And we always advocate that that should be minimal or not at all. And we know that that impacts on the jaw growth, the maxilla, which is the upper jaw, and its position becomes forward and forward pointing compared to the mandible, which becomes retruded. And so you'll have this, you'll know babies who will have overuse of dummies, where there is an open bite, where the teeth don't meet, and there's an overjet as well.
And with a child, their baby teeth and then their adult teeth, anything that happens to their baby teeth, will that sort of relate to the adult teeth, or do they get effectively a clean go?
The good news is actually we get a clean break, because as I said, the baby teeth were mineralizing in the womb. The adult teeth start to mineralize within the first year of birth, and they carry on. And we get our adult teeth between the age of 5 and 6, usually is the first adult tooth, up until 13, where we'll get our full set of 28. And then there's just the wisdom teeth, depending on the sizes of jaws. They can come through in the late teens and early 20s, sometimes not at all.
Now, you talked earlier on about, children brushing teeth and so on. And I guess that's one of the best things about coming to see the dentist at a very early stage, is you can get advice on which toothpastes to use, how to brush, and how to get your children into good habits. What's your general advice with that?
Absolutely. So getting them in at an early stage, one of the things that we talked on in the first episode of the first half was the rapport building. So again, it's another thing that I tell mums especially, is that even though there might not be much to see, if they come from 6 months to 1 year to 18 months, if they're coming every 6 months, by the time they're 2.5, if heaven forbid you need to do some kind of intervention, either a filling or a repair or some kind of intraoral work, they're not scared. Again, going back to the number one obstacle being anxiety, if you bring them in at an early age and their experiences have been positive, then often the children are very cooperative. And like you've said, also by coming and attending regularly from a young age allows us to give them that advice. And as you've rightfully said, habits stay for a lifetime, both good and bad. So if you can form good habits at a young age, then the theory is that they will then set you through for the rest of your life.
And of course, children, you talked there about, the growth of teeth, and there are invariably, they're going to have some orthodontic work.
Yeah.
We hear about braces
That's
and
right.
things like that. Talk us through that whole process, because that's, again, is really important, isn't it?
Absolutely, yeah. I think that there's two functions, there's three functions. There's eating, speaking and smiling. Those are the three functions that teeth provide. And if your teeth are growing in the wrong positions, then that will impact on all those three. So you'll have elements of speech therapy, if, your ability to, the phonetics of S's and T's are directly dependent on the position, the edge position of the upper front teeth. And if they are too far forward or they're apart, then that person's speech is affected. Of course, if your teeth are malpositioned and you have cross bites or open bites, your ability to chew and bite will be. And of course, we won't even get to the point where if your teeth are not in a perfectly straight line and you're a teenager, you don't want to leave the house. So there's no way they will face the world. So yes, it's something that the only thing I would caution, and I get this in practice on a daily basis, is that parents want intervention earlier and earlier. And that's one thing that I would just warn people against, that there is a particular window within which we can do good, successful orthodontics. And that's usually between the ages of 11 through to 15. So it's the high school years. There will be some malocclusions that start to develop from 6 and 7. But unfortunately, unless you've got a very proactive orthodontist or practitioner, the concept of interceptive orthodontics or early intervention is not very common in the UK. So in the UK, you'll normally allow the jaws, and of course there's a lot of bodily development that's taking place as well. So that tends to then tail off once they've gone past the growth spurt. So once you've done that and you know where you stand with all the adult teeth present, all the baby teeth have gone and the jaws have developed, then you can make a clear assessment, and then most people will require braces.
And the nice thing is that, of course, your dentist will guide you through that whole process. You'll get the best advice. Yeah. It always amazes me how sometimes people will listen to their uncle before they listen to the professional. It's like, you're not going to rewire your house by what your uncle tells you. So why would you do it to your health the same way? And, going for regular checkups with children, should they have checkups any more frequently than adults?
It depends on need. So I think that if you highlighted an area where there are a higher need, then certainly even the NHS allows 3 monthly being the smallest recall interval. Most people will be 6 months, and if you're a low maintenance person, between 1 and 2 years.
Now, of course, braces aren't just for youngsters, adults who've maybe never got round to it in their earlier life. So it can be done later.
Absolutely, and it's a very, very big growth area. Adult orthodontics is the most, after whitening, tooth whitening was the number one, and that was probably about 10, 15 years ago. I have to say in my current practice, I have more enquiries about straightening than I have of whitening, and the two actually go hand in hand. So it's certainly not age limited. The oldest person I've personally done treatment, I think, is 78. So there's no age limit. There's certainly no upper age limit. The lower age limit,
and
as I said, is
interesting you're talking there about teeth whitening. First of all, maybe to demystify this one a little bit. First of all, we hear of the ones operated by maybe beauty salons. We hear obviously about the dentist ones, and we hear about tooth whitening toothpaste.
Yes.
What actually works?
The short answer is the one that's professionally guided. And so even though you may say and think that the beauticians have had suitable, adequate training, of course, ultimately the people who know most about teeth, gums and mouth are dentists. So my advice would be, if you are interested in that, the safest way and the one that will give you the whitest result is through the dentist. I hear of so many patients, again, on a daily basis, who have tried to coin the phrase cheap and cheerful, and I know expense is a big issue, and I know it doesn't come cheap, but as you also know in life, you get what you pay for. And so people will sometimes invest maybe 40, 50, 80, 100, 150 pounds. And then one of the biggest criticisms is, I don't think it made any difference. And the truth is that that's probably true. And so if you want to get the best result, the one that's going to be the brightest and the longest lasting, go and see the dentist. I'm really pleased you brought up whitening pastes, because that's actually I would say almost the complete opposite to what you think is going to happen. So there's two types of staining that you have. There's extrinsic staining and intrinsic staining. So extrinsic is through dietary means, tea, coffee, smoking, those things, stains deposit on the outside. In that scenario, whitening pastes will help. But I'm going to give you a caution, because whitening pastes work through abrasion. And as I already alluded earlier, if you've got an abrasive bristled brush and you have an abrasive paste, we're dealing with teeth that are not flat. Teeth are curved. So if you have a curved surface and you apply usually a flat surface to it and it's abrasive, the most curved part is going to get the most abrasion. The staining, ironically, is in the deepest part. So by the time you've got from the rounded part to the deepest, you've worn away a lot of your own enamel in order to get to that. So there's a much easier way for removing extrinsic stain, and professionals like myself, we have access to mild air abrasion units. So there's a lot of different companies, but using compressed air and fine sodium bicarbonate particles, we can use that spray in order to get rid of the staining. So for extrinsic stain, pastes do help, but the caution is they are abrasive. So I would try and steer clear of them. And then the second issue with regards to the intrinsic stain, so that's the colour from within, the external toothpastes actually make matters worse. So if you are unlucky enough to have quite off-white teeth, using a whitening paste, the colour comes from the dentine, which is on the inside. The enamel is the window to it. And as we've said, the abrasion element, you're abrading away more and more enamel to get to the dark part. So the whitening paste is actually making your teeth darker because the inner dentine is showing through more. So in both instances, I would say try and steer clear. And if you are going to, only use it for extrinsic stain.
That's really interesting because, again, a lot of people, do the DIY version because it's going to save them money, and sometimes that can be a false economy. Likewise, going to some clinics, and we should say some, but some clinics in other countries that might not have the same strict standards that we have. One of the things that's intriguing me a little bit with cosmetic dentistry is, does that ever help actually with the overall health of your teeth if you do something cosmetically?
Absolutely. So my main focus, and certainly that of the likes of Bankview Smile Studios, is that health must come first. So if we give you the tooth straightening as an example, one of the biggest issues, if for instance there is crowding and bunching of the teeth, is that you'll find that the teeth will be overlapping or twisted. Now in that situation, trying to clean the plaque that's building up, either through the electric brushes that we talked about, the mechanical counter rotation, and even the sonic, it becomes limited. But if you then take the crooked teeth and make them straight, your ability to clean and achieve plaque control becomes so much easier. So my view on cosmetic dentistry is that it's almost having a nicer smile is a consequence or a positive side effect, but the main benefit is the health benefit. So always have that in mind first.
And coming to the tooth straightening, people of my generation, for example, will remember the braces, which were quite tough and really uncomfortable. And again, technology has moved on away from there, hasn't it?
Absolutely, you've hit the nail on the head there. That although to the layperson, certainly the newer metal braces, they look quite similar. I know that there was the famous show Ugly Betty. That's what we even refer to them as. So the metal braces, the train tracks or the Ugly Bettys, to the layperson there is no difference, but there's a huge difference. Now we're talking about the old wires predominantly were stainless steel. They were high force, low speed. So things used to take 2.5 years. I think most teenagers will tell you that that's how long the duration is for wearing. We now have nickel titanium technology. So this is technology within the metal which has shape memory in it, and its elasticity is super elastic. And we've also got low friction brackets and wires. So most cosmetic straightening is happening between 6 and 8 months, and it's far less painful. It's almost painless. Again, even though I've never had it myself, but I know some of my patients often tell me I was fearing the worst, but it was actually almost pleasurable.
Do you have to do anything? I love the way you call it pleasurable. That's an interesting take on that one. Almost. What about the the dental hygiene that you have to undertake if you've got them? Do you have to brush in a different way?
Absolutely, good question. What you've got to do, and I say this to my teenage patients before I refer them to orthodontics, is that your ability to clean does diminish when braces are there. And it's common sense when we think about it. And I say this to my teenage patients, that if you are not demonstrating good plaque control with no obstacle, how are you going to prove it with an obstacle? So the brace does become an obstacle to cleaning. You do have orthodontic brushes or orthodontic heads for your electric brushes. So do make sure that during brace treatment you change your brush. So there's specific orthodontic brushes, manual and electric. Second thing is that we already know that interproximal cleaning is important. When the wire horizontally is going across, flossing is almost impossible, unless you're a magician, where you can make the floss pass through solid metal. But ultimately, interproximal cleaning with the smaller diameter TPs or spiral brush is important. And then there's the larger size that goes from between the brace and the tooth. So yes, your time usually multiplies twice or 3 times during brace treatment, and the quality of the outcome and the speed of the outcome is directly related to inflammation. So if you can look after the brace and clean it, look after the teeth, you'll get a better result and a quicker result.
Fantastic. Some really great advice here for everybody. I want to come back to children again, because I know, as I said before, that's something that you really like to focus on, and making sure that children have great dental health. Again, maybe just give us some bullet points of the key areas of dental health for children that you would like parents to focus on.
Absolutely. So, as I said, if we're talking about a top 10 or top 3, the number 1 is brushing. Now, although many parents will tell me that initially they just chew the brush or suck it, and is that a problem? In the younger years, it's the quantity, not the quality. And what I want parents to understand is that you are role models, whether you like it or not. And so when your child is seeing you do this thing in the morning, most children will want to join you. So be that role model and just get them into the habit. So they know that in the morning I do this thing called brushing, and then at night I do it again. And then if you do it after meals, they'll do that as well. So get them into a good routine first. As they get older, and as you've said, when they come and attend, it's our responsibility, or we take a joint responsibility, that we start to improve the quality of it. Second thing is diet. And as I say to my parents, the parents of my children, that ultimately you are in charge of shopping. I know that you'll have spending money and kids will go to the shop, but even from the younger ages, if you buy the wrong things, they will find them. They have some kind of radar, and it doesn't matter where you hide them, especially if you hide them in hiding places, even under behind locks, they will find them.
Great
so
advice.
don't get it. And I know that one of the mums told me last week, but you're punishing me as well. And I said, if that's the case, that's part of motherhood.
Absolutely. And it's all great for the teeth. And I have to say, it's been fantastic having you here today.
Thank
and we
you.
really appreciate you sharing so much really, really valuable advice that hopefully all of us, as a result of which, will have better teeth.
Thank you.
Thank you so much indeed. Unfortunately, that is all we have time for today, but I'd like to thank our guest, Dr. Khalid Master, a dentist from the Bankview Smile Studios in Blackburn, for coming in. We really appreciate his great insight into the importance of good dental care and how looking after our teeth and gums is vital. And that includes being mindful of our children's brushing, as you've just heard. Once again, we must stress that should you suffer from any medical problems or health concerns, it's always highly recommended that you contact your doctor or GP, as the Health Show gives you an alternative viewpoint to the health concern being discussed. If you'd like to find out more about this or any of the subjects that we discuss on the show throughout the series, please do email us at healthshow@islamchannel.tv. Again, that's healthshow@islamchannel.tv. But for now, it's goodbye from me. See you next week. Assalamu alaikum.